potential consequences of COVID-19 has been painted as both devastating and catastrophic, with countries inclusive of Kenya preparing for the worst amidst a hope of overcoming the virus. A daily increase in both death toll and new infections globally, however, paint another scientific reality that is more than just statistical figures. So far, Kenya has confirmed 179 corona cases with 9 recoveries and 6 deaths. Tonight on Spotlight, we ask, how can Kenya flatten its curve? And how do you achieve financial discipline at such trying moment? Good evening. I am Abu Bakr Abdullahi. Thank you as always for making time for us here on Spotlight. Remember, you can be part of this discussion. Tweet us at TV47KE. The hashtag to use is TV47 Spotlight. You can be part of this discussion. Send us a message on 22047 or call us on the number on your screen, and we will gladly accommodate your opinion. My guests tonight in studio but distant is Dr. Chibanzi Mwachonda, the Acting Secretary General of the Kenya Medical Dentists and Practitioners Board. Joining us on Skype as well is Waithaka Gatumia, the CEO of Centonomy, and Jeremiah Kioni, Member of Parliament, Deregwa constituency. It's at this point only fair to say that Mombasa Governor Ali Hassan Joho was to join us tonight, but due to private and personal reasons, he won't join us. Nonetheless, the show has to continue. Good evening and welcome to the broadcast. Let me start with Daktari. Good evening, Daktari. Thank you for making time for us. Just on the phraseology of our debate tonight, we are talking of flattening the curve. What does scientifically flattening the curve mean?
Good evening, everyone. My name is Dr. Chibanzi Mwachonda, as you rightfully said. I'm the Acting Secretary General of Kenya Medical Practitioners, Pharmacists and Dentists Union. Flattening the curve is essentially a scientific term that is used in epidemiology in disease spread, because what it means basically is that you slow down the spread of the infection to an extent that you have a very slow rate and eventually zero rate of transmission and spread. So when you look at what has been happening with COVID-19 disease, is that you've had an increase in the number of cases. From the first case or the patient 0, you have an increase in the number of cases, so that the number increases exponentially to a point where if you were to draw a graph, you will see the increase, and then to a point where it stops increasing, and so the rate of spread slows down and eventually comes to like what is called a plateau phase, like if you look at a hill. So that is flattening of the curve.
We are talking of flattening the curve. I suppose for any country to flatten this curve, there must be variables that should be kept constant, are they?
Yes.
And what are those variables then?
So the variables that are being kept constant in this manner is you have to consider how the disease spreads. So for COVID-19, I think it's clear now that it spreads via aerosol, it spreads via human-to-human transmission. So basically, the guidelines of social distancing, washing your hands, and ensuring that you do not have close contact with people, and those that get sick are put in isolation and quarantine and treatment. Those are the measures that come into place, and avoiding crowding of places, avoiding movement from high areas of disease to the low areas of disease spread, so that you limit movement of people. And I think in our country right now, we've seen the first initially was the campaigns on washing your hands, sanitizing your hands, social distancing, limiting the number of people going into the crowded areas like supermarkets and the bank halls. And eventually now we've gotten to a point where there's self-containment in the high-risk counties, that is Nairobi, Mombasa, Kilifi, Kwale, to ensure that people do not move across. And
Daktari, we'll come to the measures a little bit later. Is it scientifically possible to flatten this curve entirely?
Yes, it is. I mean, if you look across the globe, even China has got to flattening the curve. Italy is getting there now, and even Spain. So yes, it is possible to flatten the curve.
Fair enough. Let me bring in Jeremiah Kioni, Member of Parliament, Deregwa constituency. At a policy level, one will suppose then that if at all the numbers today are 179, Kenya may have in one way or another invited coronavirus by not putting measures enough.
I One, I think it's important to appreciate that what the government has done. We can always say that perhaps we would have done better, would have started earlier. But it's good to appreciate and actually commend the government for this far, because they have been able to keep us aware of what is supposed to be done, how we are supposed to behave, how we are supposed to conduct ourselves, what is expected of us, what is this whole disease about. And unlike other issues that we have dealt with in this country, we have a situation where...
One will agree those are very noble measures, but they seem as though they are reactive measures. Why were we not, as a country, proactive from the beginning, if one is to ask?
Certainly there is perhaps much we would have done a little bit earlier. But if you look at the point at which the government started having those intervention measures, we were certainly still ahead of quite a number of other countries, some of them very developed. We must all agree that this is something that came with a heavier bang perhaps than what was expected. But we must continue listening to the scientists and do as they are telling us. We must appeal to Kenyans, because there is still a section of Kenyans who are a little casual in the way that we are conducting ourselves. Well, in the rural areas, like in my constituency, Daragwa, the awareness level is very high. But the observance of the conditions that have been set over and over again by the government is still a little bit wanting. There is still some bit of casualness. But I think we must commend the government. We must also commend Kenyans, because we have really tried, but we have work to do, because we don't want these numbers to grow.
All right, we will come back to that and the measures as well a little bit later in this broadcast. Let me bring in Waithaka Gatumia, the CEO of Centonomy, to talk matters financial discipline. There are words flaunted around. Some say this: we could be staring at a global crisis, a global recession worse than that of 2008. Is it economically getting doom and gloom?
Look, it's kind of hard to see or to say at this point what the outcome is going to be. And in fact, what plays into the hands of those speculators on the market is when people begin to predict. Now, I'm not a prophet. I don't think anyone on this panel is. And so we will wait and see what the outcome is going to be. However, we can begin to take control of our personal finance.
But you will agree with me that economies are measured based on specifications, and these economists and those in the financial market, of which you are part of, are raising a red flag of a possibility of this.
Look, at any time there's a possibility. If you remember any of these crises that go across borders, the possibility is there. However, as I said, there are many things that we can begin to do ourselves. I especially like to talk to people about their personal investments, and I talk to them and say, please don't make rash decisions. This is a good time to speak to your financial expert, your stockbroker, your real estate agent, whoever it is, to begin to map out a plan for this time. Because one of the biggest problems we have is people panic. And in a time of panic, then you're not making good decisions. And therefore, I'm in agreement with you. I'm not saying that things could not go wrong. I'm just saying that we don't know yet the full outcome. What we need to do is to begin to prepare ourselves for such an outcome.
Looking at some of the sectors that have been affected by this, inclusive of the airline sector, the hotels, pubs and nightclubs, exports, of course, Kenya exports tea, coffee and fresh produce, among other exports, public transport, sports and entertainment. Is this the year when one will say, for instance, and remember it as a year where they had to stretch over their pockets?
Yes, and the thing about it is this. We seem to, definitely there is an impact across the board, but the impact will be felt differently by different people depending on the level of preparedness. Because you see, the loss of a job, a loss of income can happen at any time. It's not just because of COVID-19. And therefore, when we train at Centonomy, we are always telling our clients and just saying it is about being prepared at any time, because it's not just external factors. Definitely at this time, we must be thinking about what is going on in a global market. But even now, there are measures that we as individuals can begin to make for ourselves.
Of course, we'll come back to the individual financial discipline at such a time as well. Dr. let me get you back to the discussion, understanding that what we are talking of now is a need for more, probably, if we can't escape the reality to come, a need for more ventilators, need for more ICU beds. Is this then bringing out the worst possibly that was hidden in our healthcare system?
Well, that's a very good question. In fact, for us in the medical profession and as the doctors' union that has been championing for the welfare of not just the health workers but even the public in terms of quality of healthcare, is that this COVID-19 has actually exposed our fractured healthcare system. Mm-hmm. Because the first thing that has come in terms of even equipment and infrastructure is that we realize now that we do not have enough adequate facilities that have critical care units in the ICU. We do not have enough ventilators in our facility, and so essentially what it has done is that it has actually exposed our healthcare system. It is weak. We do not have the adequate numbers in terms of health personnel, from doctors, nurses, clinical officers, laboratory technicians, to the pharmaceuticals, pharmacists and the pharmaceutical technologists. So essentially what it has done is that it has actually exposed the infrastructure aspect, the inadequate numbers, and these numbers are inadequate despite the fact that we actually have a very big pool of unemployed workers in this country.
Dr. let me ask you this question. If then this is exposing the status of our healthcare as a country, why did those who are part of the healthcare system not raise an alarm even before Corona?
I think that question is not entirely correct.
In what sense is it not?
If you remember, I think we've had very many industrial actions in this country. And if you, let me remind you let me take you back 3 years ago in 2017. 2016, December 2017, March, the 100 days doctor strike. I'm not saying this because probably to say that we did something that was, it hurt people, but the issues that are coming out at that point in time were the things that are now being exposed. The ICU, the facilities, the poor pay of the workers, the inadequate numbers and the acute shortages in health personnel in the country. So essentially, yeah, it has brought actually the picture that we were talking about, but now it has become real and it's realistic to everyone in Kenya right now.
Good. Let me ask the Member of Parliament, Jeremiah Kioni, this question. Understanding that there are restrictions, of course, put by the President in terms of movement, there are those who are adamant still calling for a total lockdown. What is your view on that?
We will have to be guided by the professionals in this area. There must be a reason as to why one calls for a lockdown. I believe that the government is using the data, statistics, and perhaps the possible numbers that are likely to be affected going forward, and I'm sure that is what is guiding them. I think what is crucial for us is to remain very, we must obey. We must be very clear in our minds as, so that we actually do what is expected of us. And that is the way each and every one of us would be contributing to dealing with this disease. If we start quarreling as to what we should be doing when, it will not be very useful. And I think this is a point where we actually need to be respectful of this one command center that has been managed very well, I can say, by Mheshimiwa Kagwe, the CS Health, so that we are doing things in a programmed way. Of course, they should listen to suggestions and ideas, but it is not good to start sounding gloom at this point. Of course, we have to be a little bit cautious. I also do not want people to play politics with this kind of a disease. It's a time when we must be very disciplined.
We will come back to that. Of course, this disease as well, today the media reports, has knocked at the doors of Parliament. We'll come back to that. But let me get to Waithaka. Someone who may have invested in the stock markets and sees it plummeting, someone who may have invested in the global supply and production chain and see it fall, how should they react?
As I mentioned earlier, Abubakar, it is not about a time for panic, but actual thought. If you are invested in the stock market, please, before you make your financial decisions, please go and sit down with your financial advisor, your stockbroker, and talk to them about times like this. Because even in times like this, there may be opportunities for you to be able to make some cash. I know that the world famous investor, Mr. Warren Buffett, talks about when people are being very cautious that you should become greedy. And when people are greedy, that's the time to be very cautious. That is true. Because
which begs the question, amidst all this fear, concern, and uncertainty of what the situation, the outcome of the situation could be, if someone is to ask, do profits even matter now?
Obviously, profit matters. That is the aim of business, is to generate a profit, definitely. However, as you have correctly said, there are times when you want to hedge around yourself to ensure that there is some kind of a protection that is there. And so on a personal basis, you need to start thinking about where your cash flows are coming from and to be able to say, do I have access to my funds so that I can be able to use them should I need them? But that's not the process of immediately just selling off, because when you sell in a panic, definitely you're going to make losses. And so the time right now is to sit down with yourself, with your financial advisor, and actually begin to make rational decisions on the choices that you're making.
All right, I understand it's quarter an hour past the hour. It's time for us to take a short break. Nonetheless, we'll be back with this and much more after this break. Stay tuned. Thank you for choosing to stay with us. Welcome back. You're watching TV47, here the home of untold stories, and this is Spotlight. Let's continue with our discussion, and remember, as earlier promised, your voice as well as a viewer will be part of this discussion. And I can see Ezekiel Muraidi is asking on Facebook, I recently saw Mombasa County was offered 10 ventilators. How many patients can one ventilator serve at a single point and time? I'm very much interested in that number. Dr. if you will answer that question.
One ventilator is for one patient. Yeah. The only difference is that in the US, because they were overwhelmed with the number of patients who needed to be on the ventilators, they managed to quickly devise a way of ensuring that one ventilator can support up to 4 patients, but that is still out of the situation they were in. It is not ideal in ventilating of patients, because every patient has a specific requirement in terms of the lung capacity. So yeah, one ventilator for one patient. So if you receive 10 ventilators, it means you're going to support 10 patients.
Good. I can see someone on Facebook, Abdi Mudalib, if I'm not wrong, is asking, how can one recover from a disease that has no cure as of now? Dr. Steele?
I think let's start from the basic point of that this is a virus, and influenza virus is one. We all get common colds every other day or every other time in seasons. And most of the time you don't need medication. It's a self-limiting illness. By self-limiting illness, we mean it runs its course maybe 7-14 days and it clears. So the same thing applies to the SARS-CoV-2 virus, also known as the COVID-19 disease. The only difference is that it has been shown to be very virulent. By virulent, it means that it has a clinical severity in terms of the symptoms. So the minute you get to the point where it affects your lungs and you're unable to breathe normally, then what happens is that you become in severe illness, and that is when you go for respiratory support. But a good number, I think if you look at the statistics across the world, the mortality rate is around 5% on the higher side, 5 to 6%.
But you also agree that still that number is high, isn't it? When countries are reporting more than 800,000 deaths in a day.
Yes, but if you look at 800,000 deaths, look at
800, I mean, not 1,000.
Yeah, so 800, and look at the number of cases in that country. So if you do the percentage in terms of deaths vis-a-vis the total number of cases, you find that the deaths account for 5 to 6% of the total number of confirmed positive cases. So yeah. It will run its course. You'll be given supportive treatment. If you have a fever, you'll be given drugs to at least ensure that you don't get a fever. There are certain drugs, the antibiotics that are being used, like azithromycin, that have been shown to have some effect on this disease, yeah. But there is no definitive treatment.
Fair enough. Let me bring in Jeremiah Kioni, Member of Parliament, the Regwa constituency, to the discussion. Let's assume that the situation changes, things are better. What are some of the lessons then that the legislature that you are part of can learn from this?
That our standing orders are inadequate. I think we will need to look at them in light of what we have learned, that there can come a time when even members of parliament are not able to get to the floor of the house. And when such times comes, how can we be able to help the country move on? Certainly, I think the other thing is that the amount of money that we allocate for our health sector, we will need to look at it again and up our game. Of course, we have more competing issues on this. It's not something that we can just wake up one day and increase the amount of or the budget allocation without considering the other needs that are there. But I think also there is need for us to manage the resources that have been allocated to this sector, and like other sectors, in a better way. Some of the things that the doctors are saying are lacking are things that perhaps would have been bought if there wasn't the level of corruption that we have witnessed in the past, and especially in the health sector.
And at that point, I earlier on asked Daktari why the healthcare system and those in the healthcare system did not voice. He says, and he said earlier on, that they voiced this and seemingly there were no ears to listen.
I think the important thing is that, with all due respect, I think we were caught when we were still squabbling. We were just making noise to one another. How are we managing this without really clear direction as to how we wanted to manage the health sector? Of course, you remember that this is a sector or a function that we devolved with the 2010 Constitution. And there are many Kenyans who feel like it should not have been devolved. So we were found before in a situation where we had not quite settled. And but having said that, I think crucially is that we also have mismanaged quite a bit of the funds that are supposed to have helped in ensuring that some of the equipment, facilities would have been in a better state if we didn't mismanage our affairs like we have done in several other sectors. So I think as members of parliament, and not just members of parliament, it is Kenyans, as the governors, the county assembly, all of us now can see that it can come to a time like now when even you yourself will need that bed that you never thought you needed it so near your rural home. You thought that the only place you can use perhaps is another hospital that is of high class. This is a situation which is teaching all of us, make sure the services are in such a state and standard that any person can use them and benefit from the facility.
And I am supposing that you must have heard of the banter or otherwise on a serious tone of Kenyans online and otherwise as well, saying this disease has no MPs running out of the country seeking treatment, no big names getting out of the country to get another healthcare in a different country. Is it time to now?
Let me add there, because
yes.
I don't think that's a very useful statement, because we have been engaged in harambes where we have helped even people perhaps with the lesser ability to move out of the country. And what we are saying that even if you can organize a major harambe because you have children who can afford, it still does not add up. What it is teaching all of us a lesson. It's not just a question of members of parliament or the leash, it is a lesson to Kenyans, humanity, that you must think of one another at all times, the poor and the rich equally. So I didn't want to use it as a way of trying to hit at one group against the other. It will not help at this time. I know that is what many of us like doing, but I think what we are learning is that wherein you have an opportunity, do that which you should do at your level best, because you never know when you yourself will be in need of that service.
You say it's time for us to reflect and learn, get some lessons from this as a country? The gravity of these lessons, one will suppose, needs to be first within the leaders, isn't it? Those trusted with the taxpayers' money making these decisions.
Yes, once you are a leader, of course, the leaders, more will be expected from leaders. Once you have those positions of responsibility, more will be expected from you. And crucially, when you're in charge of funds that are meant to improve the facilities in this country, be it in education, in health, in the transport sector, whatever sector, I think it is only fair that you use them well, because this is a lesson for all of us. I mean, we can't learn to any country. The US are struggling perhaps more than us. We are used to learning to the developed world. They are struggling more than us. We can only use that which we managed when we had opportunity to manage.
Good. I think you have made your point clearly. Let me get to Waithaka Gatumia. Waithaka, is this crisis giving us a point to differentiate between what we want and what we need financially?
Definitely, Abubakar. And in fact, it's one of the tools that we use in our training. We talk about the process of budgeting. And at Autonomy, we train on a budget that is called the ABC budget. A is essential, B is important but not essential, and C is everything else. Mm-hmm. And when you look at your budget and you can be able to see what is essential for life, and then what is important but not essential, and then everything else, then you can make financial decisions that can help you in times of crisis like what we're going through now.
I understand we have Abraham from Nandi on phone. Good evening, Abraham. What are your thoughts?
I'm Abraham.
Yes.
Ningependa
endelea nakusikiza.
Nilikuwa napenda kuchangia mada kuwa mkubwa wa enzi ambaye ni Kagwe amejaribu sana kutufunza kuhusu mambo na usafi na hygiene, yani mambo na kuosha mikono.
Mhm.
Na imekuwa ni chango kubwa kwetu, kwa hiyo ndio amekuwa mtu kama angekuwa na uwezo wa kutusaidia kabisa, lakini ni sisi wa Kenya ndio tunapuuza. So kwa kweli kama tukiendelea na kufuatilia hiyo hygiene, hasa sana upande wa Rift Valley huko mahali penye hiyo ugonjwa itafika, itakuwa ni vyema sana kama mambo na serikali na health wakiungana pamoja kila mtu kisa, na itakuwa ni vyema sana. Na nimesikia kuhusu mambo na lockdown kama huko mnaotoka.
Okay, Abraham there making his point in as far as, of course, adhering to the guidelines is concerned. It wasn't necessarily a question, but a thought that we accommodate as well on this show. Daktari, let me get to you. How long possibly will it take for a country like Kenya to flatten its curve? Is there any specification on time?
I think that we can only tell based on the progression of the disease and the number of cases. If you look at the modeling that had been done, is that by end of this month, which is April, we were expecting to have 10,000 cases. But mitigation measures have been put in place by the government. I think earlier this week, we saw the containment, and of the 6 counties that have been put under containment. So those are mitigation measures that will be able to tell after the 21 days whether, one, the progression of the cases has met what was being projected based on the modeling, and 2, whether we've had an increase in the number of cases or decrease in the number of cases, or maybe we've had, third thing, is a slowdown in the rate of increase of the cases. But
the number as of now stands at 179 cases. This is inclusive of the recoveries and the deaths. Understanding that there are counties that are registering their first cases for the first time. For instance, Mandera County registering 2 cases yesterday, Kisii County. Should there be a worry that this disease as well is devolving to the counties?
I think we shouldn't worry and we should not panic. That's the most important thing. The underlying thing is that we are at a level of community spread. Community spread means that now it's not being brought to the country by travelers from outside this country. It is spreading across the communities in this country. And how it was also spreading was, one, movement from the high-risk counties to other areas. So the fact that we've had mitigation measures put in place to restrict movement from high-risk counties to other counties, then that should come in handy in reducing the number of spread. So don't be surprised if we get new cases in the other counties that are yet to record any number of cases. People have been traveling for the last 1 month or so, or even since we registered the first case of coronavirus. So it's only a matter of time. Remember, the incubation period is 14 days, but it can go up to 21 days.
Good.
So
Let me interject you at that point. I understand we have John from Bungoma on phone. John, good evening. Tuko salama, labda wewe. What are your thoughts? Changia.
Kitu nataka kusema, kwanza nataka kuongeza mikakati ambayo imewekwa na serikali. Lakini mikakati ukiteremka hapa chini kabisa ngazi za mashinani, hiyo mikakati ni ya haifani. Nikisema sahihi kama kusema Mungu mwenyewe peke yake kwenye mambo na kusaidia na sisi tuweze kutekeleza mikakati ambayo tumewekewa na serikali. Hebu angalia watoto wanacheza pamoja bila siasa. Hebu angalia watoto hata wengine, mimi nimewaona wananunua kitu kama ndazi pale, alafu wanakawana hata bila kuoga mikono, hata na maji tu, hata na sabuni ya watoto.
John, ningependa kukuuliza swali moja kabla tukuachilie. Kwenye huko watu are people following the guidelines? Watu wanafuata agizo? Okay, that's John from Bungoma calling us. Remember, as a viewer, you can be part of this discussion. Twitter us at TV47KE. The hashtag to use is TV47 Spotlight. And remember, once you call us, at least be far from your screen so that we have a conversation between us here in the studio and you, wherever you could be in the country. Let's continue with the discussion. Let me bring in Jeremiah Kioni to the discussion now. Understanding that different counties have taken initiatives to mitigate the spread of this virus. In your own view, do you think these measures that the counties are implementing, are putting in place, are enough?
They are useful, but I think they need to be coordinated so that, like I said, it is always important to have reference to that central command center, so that the measures that you put in your own county are in tandem with what we are doing as a nation. And again, it is not a thing that the governor decides with his team there. It is there are guidelines that are guided by the data or the findings that have been received at the national level. So it is important for those at the county level to come up with measures, but those measures must be running in line, or they should not be running against what we have already agreed as a nation. I know counties like Nyeri, they're trying to do some little bit of checking the temperatures and such things to ensure that those who are coming in are not affected or are not positive or that kind of thing. Good measures, but again, they may not have the necessary equipment to confirm. They may also create some panic level. If you tell a person in a public vehicle that you look like you have this virus, again, you have not made the necessary arrangement to isolate the person on the ground. You may just create some panic and pandemonium that. So it's good, but then they need to be coordinated from the national level. I don't believe that our counties have the capacity to do some of the things seen some governors wanting to do. Other than those ones of Mombasa, Nairobi, maybe Kisumu and Eldoret, perhaps we have to be a little bit more careful.
Good. Waithaka, let me ask you this question. Understanding that we are in an economic tough times, at the backdrop of this, people being sent on unpaid leave, budgets, of course, falling for companies because of the unprofitability as of now. How does one live within their means at such a time?
I said it before and I'll say it again. We must now begin to be serious about our own personal budgeting process. It's no longer that mental budget that you have where you know your rent, you know school fees, and you know maybe one other major item. Now we have to be detailed with the money that we have. And so first of all,
and what does that detailed means?
It means you must know every cent that is coming out of your pocket. Just the same way that you take care of your employer's money when you're using the money for the company that you work for. That's the same level of detail that you need to have with your own. So tracking your expenses is extremely important, being detailed with what you're purchasing. And at this time, let us just be honest, this is not a time for luxuries. I know you may have been used to a certain style of a certain lifestyle. It's time right now to get serious and say, we might be in this for a while. During this time, I am going to be organized. I'm not saying that we don't spend on everything. I'm just saying that you must take control. The problem that we've had is that often people are not in control of their personal finance. Often they are controlled by advertising, they're controlled by their stomachs, by their eyes. Now we must be controlled by our mind. So track your expenses and put down an actual budget that you are aware of and that you're taking action with.
Fisi Njugamai, what her name on Twitter, is asking, my question, Abubakar, goes to the CEO of Centonomy. What are some of the measures that companies can are put in related to the mental health of the physicians who are in the front line battling coronavirus? Is this going to have a mental health effect to the healthcare workers?
It's only a matter of time. We should be able to do that assessment after or during, as we go forward. In fact, one thing that needs to happen, and Red Cross is already doing it, is psychosocial support for the healthcare workers. So in terms of mental health, it will be an assessment even after the coronavirus pandemic has been dealt with.
All right, I understand we need to take another short break here on Spotlight. We'll be back after this break with more of this discussion. Stay tuned. All right, welcome back. Thank you for staying with us. You are watching us live on TV47. The discussion tonight that we are making sense of is how Kenya and other countries as well can flatten their COVID-19 curve. Amidst that as well, how do I stay financially disciplined? You can be part of this discussion. Tweet us at TV47KE. The hashtag to use is TV47 Spotlight. Waidaka, let me start with you again. I think before we lost you, someone had asked on Twitter, Fisi Njugamai. He asks, my question, Abubakar, goes to the CEO of Centonomy. What are some of the measures that companies are putting up to ensure they stay put during these tough times?
So definitely as companies, we must go into a season of cost cutting. It's just like a personal budget. We are doing it the same way with a company. Those things that are not vital for company running, we put them aside. Generally, this is not probably the best time to be starting a major new project. That kind of investment, you want to keep that money aside. You need to be as liquid as possible to take care of the main needs. As a company, you want to also involve your team in that cost cutting, because sometimes that cost cutting comes at the cost of your team members. But at Centonomy, we've been trying to talk to our, especially those who are in the entrepreneurial space, please keep people employed. I love what some of the big companies have been doing. They're keeping people on board. Maybe you have to cut the salaries a little bit, but have them there because they will be the solution to what we are going to go through.
It's good that you
go as a last point. As a last resort, that's when now you think about letting people go. That's my opinion.
It's good that you talk of big companies. One will ask the question, if there are companies that have been bragging of their financial strength for the last 10 years, why should they be in a worry 1 month later in such a problem?
That's true, and I'm sure this, especially for those companies that are listed on the stock exchange, we will see the truth in the next few quarters about what that financial position was. But it's not a time to point fingers and to be calling people out. We must work together as a nation, as employers, to ensure that we keep this economy moving. And that is only done by keeping people moving and using that resource, that human resource, the ingenuity that is out there in creating the results that we want, the outcomes that we've been looking for.
All right, let me ask Jeremiah Kioni this question. Earlier on in our breather, you talked of resources and the country being serious of how it manages its resources.
Yes, thank you, Abubakar. And even before I come to that, I think it's also important to mention that even as we talk about the big companies,
yes,
I think it is important for us to have it in mind that the informal sector continues to employ the biggest number of Kenyans. And when we are thinking of how to keep them going, they should be given quite some consideration. If the government will have resources or money that they would want to inject in the companies, they should also pay a lot of attention to the informal sector. That is our drivers in a big way. And even the informal sector should be helped to ensure that those there are also not laid off. But
is there a possibility of the government bailing out some of the financially struggling companies?
I think it is something that the government will have very little choice. They will have to do it. Whether we are going to borrow money from wherever, it is something that the government will have to consider doing, because that is the only way, in my opinion, and we have the specialists with us, of jump-starting this economy. We need to ensure that we get it moving perhaps faster than what would happen if they are not helped. And I think the government is thinking through some of those things, and that's why even Parliament will need to come back, because some of these are ideas that will have to be discussed and eventually approved by Parliament. And I know that there's quite some work that will need to be done in that line. But coming back to the question that you've put up on the issue of resources, I think a good example is the issue of water. We have we received more rains than ever before. I think the last time we may have received the kind of rains we received, I'm told, by those who are there, is back in 1961. But even in the height of those heavy rains, we still had water boosters in Nairobi, people selling water with tankers, taps running dry. And here we are now. One of the guidelines that we need to do is to wash our hands as often as we can. But we again have been caught napping. We didn't provide piped water when we should, and the water was there. But because there is some business that needed to be made by some individuals, again, we denied Kenyans that resource. But now we are being forced to go out of our way.
Fair enough.
Perhaps to give tanks in shopping centers instead of piped water, we should have done much earlier. Again,
trickling it down to accountability in the system, isn't it? Fair enough. I think you've made your point. Dr. Let me ask you this question. When the Health Cabinet Secretary says, and I quote, "Brace for bad news and be ready because all measures we are taking won't stop a disease that is already here." What will that bad news entail? I know you are not in his mind to explain what exactly that will, but as a healthcare, when the ministry says this.
Yeah, one, I'm a doctor, so I do understand and I read around a lot of, in terms of epidemiology of diseases also. So essentially what he was trying to say is that I think Kenyans are at this point where they, I've met a number of Kenyans who keep calling and asking, how long are we going to see the number of cases increasing? So the reality when he says that is that, one, we're at that stage where we're on the exponential increase phase in terms of the graph that you want to flatten. So the number of cases will keep going high because the contacts that are being traced are still high. There's still a big number of Kenyans and contacts who are yet to be tested, and they will turn positive. So every day that they come out and they read results of the test is that you will get positive cases. So what he means by bad news is the more you have the number of cases, also remember that you'll also have mortalities. And that's what I was telling you about, that for every, the mortality rate is around 5%. So for the total number of cases that you have increasing, you also have deaths, but equally you also have recoveries. So the bad news, I think, is that we do expect an increase in the number of cases. We do expect mortalities. That is normal at this point in time, until that point where we'll have said, now we have flattened the curve and things will slow down.
Crop on Twitter, Crop J Kamuto on Twitter is asking, our facilities are not enough. Kindly ask the doctor whether there are plans to erect structures such as China did when the situation was worsened.
Yeah, so I think the government is trying to come up with facilities. In fact, even today as KMPDU, we have presented a memorandum to the Senate committee, the ad hoc Senate committee on COVID-19, and that we have equally said that it's high time that we have structures, especially for isolation and treatment, put up very fast, and also critical care units where you have these ventilators. Remember that the ICU spaces that are currently there are being utilized by normal patients who require ICU care. You cannot mix patients, COVID-19 patients, even in the ICU. So those are plans that are already in place, I think, in the counties. And
good. Daktari, I understand we are out of time. Nonetheless, let me give Waithaka Gatumia and Jeremiah Kioni a minute to answer two of these questions. And Mheshimiwa, I'll start with you. What is the way forward then for Kenya as a country in as far as battling this virus is concerned? In a minute.
Making sure that we remain faithful to the guidelines that were being given by the government. And also going out of our way. If you think that you have the symptoms, you can also do what they are calling self-isolation, so that you also protect your members of your own family and also those near you. I think there is a lot that each and every one of us has a lot to play in ensuring that we bring this situation to under control as soon as possible.
Good, I understand we are extremely out of time. Waithaka, let me ask you this question. For someone probably who is wondering, is there a possibility of making more profits at such a time? How do I grow my finances at this trying moment? Are there any measures they can take?
Oh, definitely. There are some industries that are booming. Right now, we are using Skype, which is a technology that we would not have been using if it were not for COVID. And so those who are manufacturing masks, those who are doing technology like this, those who are managing to leverage on the needs that are there, delivery of food and goods to your houses, that's gone up exponentially as well. The opportunities are there if our eyes are open to them, Abubakar. But let me just say this very quickly. This is a time not to be selfish. This is a time to be selfless. Let us take care of one another. And if you have not been affected financially, take care of somebody who has.
All right, thank you, gentlemen, for making time for us. But nonetheless, one last final question to Daktari. Daktari, the question of masks and putting on masks is an issue that has been fronted both by medics and the Ministry of Health as well. Should people be putting on masks at every time?
I think the stage at which we are in, it's safe enough to prevent aerosols from getting into the air and when you're speaking. So in crowded places, it is essential for you to have some level of protection. Cloth masks have been put forth. The surgical mask, let us try as much as possible to have them used by the healthcare practitioners, not the general public. The general public that is not showing any symptoms, that is not sick, that is just seeking to protect themselves in these places that are crowded, or rather in areas that are open, where there's so many people, they should just put on cloth masks. And I think they're being made pretty fast in the country right now. I've seen a number of, in town with very good designs of cloth masks. Cloth masks, yeah. So it is actually a good measure.
All right, gentlemen, thank you for making time for us, Dr. Chib. Yes?
As you go away, let us make sure that let the government know that there are families that are.
All right, I think we have a problem there, but nonetheless, thank you for making time for us. And the regular member of Parliament, Jeremiah Kioni, Waithaka Gatumia, the CEO of Centonomy, and Dr. Chibanzi Mwachonda, the Acting Secretary General of the Kenya Medical Dentist and Practitioners Board. That brings us to the end of tonight's edition of Spotlight. I am Abubakar Abdullahi. On behalf of the entire team that made this production possible, bye for now. Keep a social distance, wash your hands, stay safe. If you can, stay at home. Good night and God bless.